Hi, this is Dr. Greg Oliver, Fat Doctor TV. Let's talk about pain. We're going to talk about the pain of joints. So, as you carry more weight, you're going to put more strain on your joints, especially what we call the weight-bearing or load-bearing joints of the body, such as the feet and ankles, the knees, the low back, and the hips. Now, we see lots of patients with what we diagnose as osteoarthritis. Osteoarthritis is one type of arthritis, very prevalent. There are lots of factors behind it, some genetic, some aging, but one of the most important factors is just load bearing. The more load you put on those joints, those weight-bearing joints, the thinner and the more pressure you put on the cartilage. You thin them out, you wear them out sooner. So we see this in athletes who put a lot of miles and a lot of wear and tear on their joints. We see it in people who work really heavy jobs where they do lots of lifting. They put lots of load on those joints. And we also see it in people who carry around too much weight. One of the biggest things I see is premature joint replacement, such as knee replacement, hip replacement, at a very young age due to the fact that someone carries around an extra 50, 7,500 or more pounds. The more weight you carry, the greater the load is to those joints. And so if you think about it, two joints come together. There's cartilages on the surface of those joints. If there's more weight, then there's more pressure. There's more of a grinding factor. There's more wear and tear on that joint. And so the first thing that happens before you wear the joint out, though, is the joint gets irritated. The joint swells. The joint has pain. It's difficult to move sometimes. Stiffness can develop. And so many people who carry weight tend to have a lot of back pain, knee pain, and hip pain. Now, I have patients who've lost their weight on our weight loss programs and their joint pain disappears. Now, that's very possible if you haven't done permanent damage to those joints. Once permanent damage is done, there will be some discomfort from time to time. The other thing we see happen is people who carry a lot of weight on those joints tend to have damage to the cartilages. Everyone's heard of torn cartilages, and we mostly think about that in athletes such as football players tearing the cartilage in their knee, or we call meniscus. But just carrying significant extra weight puts heavy torque or twisting motion on those joints when you turn and twist and move, and you can tear and disrupt that cartilage. Once that cartilage is torn and disrupted, it tends to cause problems with walking. You can have locking up of the joint, swelling of the joint, bleeding inside the joint. There's lots of problems that occur. Of course, there are treatments for these things, but our preference is that we avoid the damage to begin with. So it's very important to think about this as one of the reasons that you want to drop the weight and get leaner, is to take the load off those joints. Once you take the load off the joints, the cartilages fluff up again. There are some treatments and supplements that can be used for that. But most importantly, just taking the load off the joints. So for every pound of weight you carry, you're putting about 4 pounds of pressure on those joints. Those cartilages are meant to be shock absorbers in our joints, and when we squeeze out the shock absorbers, the damage is done. Think about it like this: if you have a pickup truck or a vehicle and you put lots of heavy weight in it, you're going to be pushing down on those shocks and springs, and if you do that long enough, you'll wear them out. So don't wear out your shocks and springs. So another reason that you want to get the weight off, take the load off the joints, and put a little more spring in your step as you get older. So we'll talk to you next time on Fat Doctor TV. Hope you get lean between now and then. Take care. Have a great day. Bye now.